Today the topic is very important and concerning. It is a disease exclusive to males. It's a prostate disease. Today I'm going to explain to you exactly how this works and what you should do to minimize the risks. We need to keep an open mind and understand the mechanism, how it works. What is the function of the prostate? The function of the prostate is to produce a fluid that protects the sperm. Together with the seminal vesicle, plus the sperm produced in the testicle, it forms semen. If sperm doesn't have semen, it dies. There's a chance it won't survive in the vagina or the uterus because the woman's vagina has an acidic pH and the prostate alkalinizes, makes the semen's pH alkaline, so it can withstand and protect the sperm. So the prostate is an extremely important organ in our body. Therefore, we need to take care of our prostate. The prostate will grow in men. This is a natural evolution of human beings. From the age of 50, most men already have a slightly enlarged prostate compared to its normal weight. The normal weight of the prostate is 20 grams, but it increases as the years go by. It can grow as a whole, which is called benign prostatic hyperplasia, or benign prostatic hyperplasia can also cause only part of your prostate to enlarge. This may or may not cause symptoms. People who have prostatic hyperplasia, many people have it, don't even realize they do. They're urinating well, living a normal life, sometimes even at 60 or 70 years old. Now, if you've started having difficulty urinating, waking up 3 or 4 times a night to urinate, or feeling like your bladder isn't completely emptying, you urinate, but it always feels like there's still some urine left in your bladder. You don't get that feeling of relief. Then, after you've gone to the bathroom to urinate and think you've emptied everything, suddenly urine leaks into your clothes without you wanting it to. So people say, wow, Giuliano, I have to go to the bathroom. I have to go. After I pee, after I urinate, I have to wait to see if anything else will come out because I end up wetting myself a lot of times. When I think I'm done, I'm leaving the bathroom and then suddenly urine leaks and I end up soaked. This is a characteristic you need to pay attention to. Why? It's a sign that your prostate might be enlarged and could be causing you problems. The urethra, which is the channel that connects the bladder where urine is stored, the urethra is the little tube that carries urine through the penis to the outside. In the middle of this path between the bladder and the urethra, there's the prostate, which has the little tube passing right through it. If it grows outward, that's fine. The problem is that if it grows inward, it effectively blocks this vital passage, which is the urethra. As a result, those symptoms I mentioned to you will occur. Another very common thing is when someone says, in the past I could urinate with a strong stream, now my urine stream is thin, very weak, I almost pee on my own feet. Before, you could stand far from the toilet and still urinate. Now you have trouble, it's dripping onto your feet. This, folks, is a sign that your prostate is enlarged. It's nothing to worry about. How is this diagnosis made? You go to the doctor and the doctor will perform a prostate exam. How is this exam done? It's very simple. You lie on your side, the doctor puts on a glove, applies some lidocaine to the glove, and performs a rectal exam. And with this rectal exam, it's possible to feel part of the prostate. So when you do the exam, the prostate has a consistency similar to that of your nose. It's a fibroelastic consistency, so you feel 2 little bumps. When you do the exam, you feel 2 little bumps, a valley bump. Some people have 1 bump that's large, others have everything enlarged, everything raised and increased. Then you get an ultrasound to check and the prostate is at 100 grams. Then the person is experiencing symptoms. It's necessary to take some specific medications that the urologist will prescribe to reduce the inflammation and swelling of the prostate, let's put it that way, so that the little channel opens up and makes it easier for urine to pass, improving your symptoms. Many people get worried about prostate cancer. Prostate cancer is independent of whether your prostate is enlarged, has hyperplasia or not. So starting at 40 years old, it's very important to begin prostate cancer screening. Prostate cancer, many times when you do the digital rectal exam, as I explained to you, you can feel it even if the person doesn't have hyperplasia and the prostate is normal. You might feel something like a little grain of rice, a small hard spot in one part of the prostate. That could potentially indicate the presence of a tumor, and your PSA, which is a specific blood test done as a crucial marker for prostate cancer, might be significantly altered or it might not be, depending on various factors. That's why it's important to combine both methods. You might perform a prostate exam on the patient and not feel a tumor or nodule, but the PSA could be elevated, or you might do the prostate exam, feel a lump, but the PSA is normal. So if you're afraid or hesitant to have a digital rectal exam, because unfortunately, there are many men who, due to a certain machismo, feel embarrassed to undergo this test, it is extremely important to have this exam because the earlier you get diagnosed, the quicker and easier the treatment will be. It's a treatment you can undergo calmly without stress or rushing. Nowadays, there are surgeries that can be performed by prostate video laparoscopy with side effects that used to be extremely concerning, such as sexual impotence. This is extremely important for men, and many were even afraid to have surgery because of this. Today, there is video laparoscopic surgery that greatly reduces the incidence of this issue. There are other methods besides this type of surgery, as I mentioned to you, that can also solve an initial problem. The problem is when you only get diagnosed late. Then there can be metastasis, although metastasis is somewhat rare in prostate cancer. Less than 10% develop metastasis, but it is very debilitating because metastasis is when the tumor spreads far from the prostate and the main site is the bone. This causes the person to feel bone pain, so it becomes very complicated. Now, Giuliano, is there a truly effective and reliable preventive test or screening method that can genuinely help me know if I'm potentially heading towards developing prostate cancer in the future? I'm not currently concerned, as my PSA level is perfectly normal, and my prostate examination also indicates that everything is completely normal. Is there any test that can say, look, you are heading towards prostate cancer? Yes, there is such a test. It's called Estronex. It's a test that measures estrone. This test is extremely important because it measures 2-hydroxyestrone, 4-hydroxyestrone, and 16-hydroxyestrone. The 4 and 16 are carcinogenic. You're not there yet, but you're heading in that direction. So it's possible for you with a dietary change to shift towards the good estrone. Oh, tell me some food I can eat. I don't want to take this test. I'm not going to take this test. So as a form of prevention, you're doing it blindly, okay? If your PSA is normal, your prostate is normal, and you want a healthy diet, start using golden berries, start eating cruciferous vegetables like cauliflower, cabbage, broccoli, okay? So there are things we can prevent even without knowing whether we have it or not. This is the way, folks, the way of prevention. There's something very interesting that's used for people with benign prostatic hyperplasia, which is lycopene, an antioxidant that has a really great effect on the prostate. There are studies showing this. It's found in tomatoes, but not in raw tomatoes. You have to make tomato sauce. Natural tomato sauce, okay? Nothing artificial from the supermarket. You go and make the tomato sauce yourself. This tomato sauce is extremely rich in lycopene. You'll also be protecting your prostate. That's it, folks. That's today's message. Thank you so much for your continued support. Have a great week and God bless you.